Today, we delve into a groundbreaking approach to cancer treatment that is shifting the medical paradigm. We will explore the potential of metabolic therapy to transform the way cancer is treated, focusing on the pivotal role of the ketogenic diet. If you're a patient, a caregiver, or simply someone curious about the latest advancements in cancer care, this video is for you. Let's take on this informative journey together. Disclaimer: this video is for informational purposes only and does not constitute medical advice. Please consult a qualified healthcare professional for guidance specific to your situation. Cancer remains one of the most formidable challenges in healthcare, but recent discoveries in cancer metabolism are opening new doors to treatment. At the core of this breakthrough is the understanding that cancer cells exhibit distinct metabolic characteristics compared to normal cells. This video will explore the evidence-based rationale behind metabolic therapy, particularly its potential to starve cancer cells by cutting off their sugar supply. Metabolic therapy is based on the principle that those with damaged mitochondria, such as cancer cells, rely on glucose and glutamine as fuel sources. These cells lack the ability to utilize other energy sources like fatty acids. As a result, they convert glucose to lactate through fermentation, leaving behind lactic acid. Interestingly, even in the presence of oxygen, these cells favor fermentation over aerobic respiration. Lactic acid serves as an indicator of this metabolic process and can be detected through various methods such as blood tests, imaging techniques, and biopsy. One of the hallmarks of cancer is its ability to reprogram cellular metabolism to meet the energy demands of rapid growth. Cancer cells exhibit a high rate of glucose consumption and lactate production, even in the presence of oxygen, a phenomenon known as the Warburg effect. This metabolic shift allows cancer cells to support their increased energy needs and proliferative capacity. Understanding the metabolic basis of cancer has led to the development of novel therapeutic strategies aimed at targeting the unique metabolic vulnerabilities of cancer cells. The Warburg effect refers to the observation that cancer cells predominantly rely on glycolysis, the breakdown of glucose for energy, even in the presence of oxygen, which is unusual because normal cells would typically use oxidative. This phenomenon is attributed to the altered metabolism of cancer cells, which exhibit higher rates of glucose uptake and lactate production. The Warburg effect suggests that cancer cells have a preference for anaerobic metabolism, enabling them to grow rapidly in low-oxygen environments. Targeting this metabolic feature of cancer cells has emerged as a promising therapeutic approach. Indeed, if we can somehow switch off the enzymes needed for these pathways, then we could potentially kill the cancer cells. The first step is to cut off the food supply. It is well established that cancer cells consume large amounts of glucose, up to 20 times more than normal cells. In addition, they also consume a lot of glutamine. We can target these nutrients to selectively kill cancer cells while sparing healthy cells. By depriving cancer cells of glucose and glutamine, we can starve them and prevent their growth and spread. There are two ways to achieve this. The first is through fasting, and the second is through the use of certain drugs. Fasting has been shown to slow down the growth of cancer cells and make them more susceptible to various forms of oxidative stress. Some drugs that have shown promise in this regard include metformin, which is used to treat type 2 diabetes and is thought to work by reducing the availability of glucose and glutamine to cancer cells. And the second drug is called 6-diazo-5-oxoenol, which is an anti-metabolite that interferes with the metabolism of glutamine. This is where the ketogenic diet comes into play. A ketogenic diet is a high-fat, low-carbohydrate diet that has been shown to starve cancer cells by reducing the amount of glucose available to them. When the body is on a ketogenic diet, it produces molecules called ketones that can be used by cells as an alternative energy source. Cancer cells are unable to utilize ketones effectively, leading to their starvation. Clinical trials have demonstrated that a ketogenic diet can improve the effectiveness of chemotherapy and radiation therapy in animal models and human patients. Interestingly, it has been observed that cancer cells often exhibit a vulnerability to the absence of glucose, showing signs of stress and even cell death when deprived of this essential nutrient. This sensitivity to glucose deprivation can be exploited in therapeutic strategies to target and destroy cancer cells. The ketogenic diet and metabolic therapies are areas of active research in cancer care. While some early studies show potential, these approaches are not currently standard treatments and may not be appropriate or safe for all patients. Always consult your oncologist or healthcare provider before making any changes to your treatment plan or diet. In conclusion, metabolic therapy holds immense promise as a revolutionary approach to cancer care. By understanding the unique metabolic characteristics of cancer cells, particularly their reliance on glucose and glutamine, we can develop effective strategies to starve and destroy these cells. The ketogenic diet has emerged as a powerful tool in this fight, offering a means to deprive cancer cells of their primary energy source. As research advances, metabolic therapy is poised to transform the way we treat cancer, offering new hope to patients worldwide. Thank you for joining us today. If you found this information helpful, please don't hesitate to share it with your friends and family. Together, we can make a difference in the fight against cancer. Stay healthy, stay informed, and keep fighting. Until next time, take care.